Hi everyone, Nurse Nikki here. I'm a registered nurse and cosmetic nurse injector here at City Facial Plastics. Welcome to my channel. Today I want to go over some important information about lip filler. I have a nice patient here today and she's going to allow us to inject her lips on camera. So let's go over a little bit of information beforehand. So let's talk about recovery time. Two of the most common side effects that patients will always experience are swelling and bruising. It's common for 2 weeks post-procedure. So if you're having a wedding, a birthday, anything you're going to be photographed or filmed with, it's best to wait to plan for those procedures after the fact. I think it's also important to mention that how your lips look leaving the office is not how they're going to look when they're fully healed. They will decrease in size about 20 to 30%, I like to tell all of my patients. The reason I like to say that is because I usually come across two patients in the office, one being the patients that are really worried about the swelling. When they leave the office, they feel like their lips are looking way too big, maybe even duck-like, but I promise you after the 2 weeks of healing, they love the results. And this chair, this office is a duck-free zone here at City Facial Plastics. We like to respect your natural anatomy here. So the second type of patients that I come across are those who love that swollen look. They can't get enough of it. And after the 2 weeks, they're calling the office up for more filler. And I love that for your lip journey, but please keep in mind, if you love the way your lips look immediately after a fill, I always suggest to wait 2 to 3 months for a stacking session. And this waiting period is so important because it will allow your injector to get a more accurate assessment of how much product that your natural lip anatomy can tolerate without things like lip filler migration. So slow and steady always wins the race with any type of filler. I feel like the beauty when it comes to filler is in its subtlety. We want you to love your results for years and years to come. I mean, you have to think about it. You spent all this time, all this money building a beautiful shape and a beautiful result. And the last thing we want to do as injectors is book a dissolving session because of complications later. One very important question I will always ask you during your consultation is, are you prone to cold sores? If you are, I recommend taking an antiviral medication 1 day before your appointment. And if you're not prone to cold sores, you don't have to worry about this step. The reason I say this is because the trauma from the needle punctures along with the swelling can be particularly triggering for people who regularly get cold sores. So we want to try to avoid that. So please be honest in your consultation. It's something that we can definitely avoid. So a little bit about aftercare. 24 hours after your treatment, just avoid exercise and any type of alcohol. I like to say that if you're in a little bit of pain or soreness, Tylenol is okay to take, but please avoid any blood thinning medications like ibuprofen, Excedrin, Aleve. And if you're on those prescribed by your primary care physician, don't stop taking them unless it's medically necessary, and we can also prepare you more for your treatment. So if you do not avoid these aftercare instructions, they can also increase swelling, bruising, and have delayed healing. Not to scare you, but this is a medical procedure and it does not come without risk factors, just like any other medical procedure, that being a simple procedure like Botox or something like general anesthesia surgery. So prior to your treatment, you will go through a consent form with all of those risks listed. The worst case scenario with fillers in the lips or in any part of the face is what we call a vascular occlusion, and that is a blocked blood vessel. If left untreated, that's where we can run into problems like tissue necrosis. But not to worry, before getting to that point, there are various signs and symptoms to look out beforehand. Vascular occlusion can happen with any injector, and none of us can guarantee that it will not happen. That's why in every office you go to, you do sign a consent form. But what you can do is research a qualified practitioner, and when you find that person, really have trust in them that if something were to arise like that, that they would be confident enough to help you right away in that situation. So we're going to meet my beautiful patient now, and we're going to inject her lips. Let's do it, guys. Hi guys, we're here with my beautiful patient Bianca.
Hi.
And we're going to inject her lips. Let's do it.
Is this a stress ball?
Stress ball, just in case. I can't hold I can't hold your hand. All the way back, my dear. And then I'm going to have you scooch up, okay? Come here. forget to go to my Instagram to check out the before and after. Thank you so much for watching. I hope you found this information useful and helpful, and don't forget to like, comment, and subscribe. See you next time.